Hello guys, today we'll discuss about body fluid composition. Human body consists of about 60% water, minerals they are 7%, fat is 15% and proteins are 18%. Organic substances present in the body they are glucose, amino acids, okay, as well as other proteins, fatty acids, other lipids, hormones and enzymes. Okay. And inorganic substances present in our body they are sodium, calcium, potassium, chloride, bicarbonate ions, okay, phosphate, sulfate, etc. Now, some substances are more in extracellular fluid, that is fluid outside the cell, and some substances are greater in intracellular fluid. Let us discuss. Substances in extracellular fluid and intracellular fluid. Major substances in extracellular fluid, they are sodium, chloride, bicarbonate, glucose, fatty acids and oxygen. If you can remember the value, that is also very good. In extracellular fluid it is 142 milliequivalents per liter. Yeah? Intracellular fluid, important constituents they are potassium, magnesium, phosphate, sulfate and proteins. As we have discussed, total body fluid is 60% of body weight, which means if the adult male body weight is 70 kg, then 60% of 70 means from 100 it is 60, from 70 it would be 42 kg or 42 liter is fluid. Okay? So in healthy adult male, total body fluid is 60 to 65%, and in same thing in healthy adult female, this percentage is less. Why it is less? Because females they have more fat. The same way thin individuals they have more water as compared to obese individual. And in old age also this body fluid decreases. Now, normal distribution of total body water in different compartments that is regulated by various pressures, and these pressures are: one is hydrostatic pressure and other that is osmotic pressure. Okay. Now, as we have discussed, this is total body water which is 60%, or you can say 42 liters in an adult male, which is further divided in two compartments. Number one is intracellular fluid inside the cell, which is a major compartment, that is 2/3 of total body fluid. It is about 28 liters from this 42 liters. Okay, so say all the things are same, 2/3 or 28 liters. Extracellular fluid is lesser than intracellular outside the cell, this one, that is 1/3 or it is 14 liters. Now again this extracellular fluid compartment has further compartments. One that is plasma. Plasma means the fluid which is inside the vessel. So it is extracellular intravascular fluid, means outside the cell but inside the vessel, that is a fluid part of blood. Second one is interstitial fluid, that is between the cell, so that is outside the blood vessel. So this interstitial fluid is known as extracellular and extravascular, outside the cell, outside the vessel. And very small amount, that is transcellular fluid, which includes this plasma is 3 liters, interstitial fluid is 11 liters, and in very small amount, that is transcellular fluid, which is present in the small cavities like our cerebrospinal fluid, like inside our eyeball intraocular fluid, inside the digestive tract digestive fluid, serous fluid, synovial fluid, that is in the joints, okay, as well as fluid in the urinary tract. So these are transcellular fluid. These compartments and their volume. So many times this you can take a screenshot of this one. This may be asked as a question. So total body water, if we are taking it in the percentage, that is 60%. Percentage of body weight, that is 60%. But if it is percentage of body water, it is 100%. Why 100%? Because 60, that is if somebody has 60% of water, means body water is normal percentage. Okay. And if we are taking in the kilogram or liter, that is 42 liter. Intracellular fluid, that is 40%. Okay, or you can say from this 60 it is 40, or if we are taking this from 100, that is 2/3. 67%, and in liter that is 28 liters. Extracellular fluid in liters it is 14 liters. In body weight percentage 20%, and in body water percentage to 1/3. Sorry, this is 33%. From this, plasma is 3 liters, interstitial fluid is 11 liters. 3 liters means 5% and 11 liter is 15%, or you would say this is 8% of body water and 25% of body water is interstitial fluid. Now, how this body fluid volumes are measured? For that we use a dye. So the method is known as indicator dilution method or dye dilution method. What is the principle of this method? Here you can see the principle is V is equal to amount of any indicator or any substance which is injected minus amount of the substance excreted divided by concentration of the substance in the sample of fluid, that is equal to volume. So V is equal to amount injected minus amount excreted divided by concentration of the substance in the sample of fluid. Now, whatever dye we are using, it has some criteria. Which are those criteria? Number one, it must not be toxic. So one is it should not be toxic. One. Second, it mixes with the compartment. Suppose if we want to measure extracellular fluid compartment, so it must be there in the extracellular fluid. We have different dyes for measurement of different compartment volume. Third, it is easy to be measured. Easily we can measure the dye concentration in the fluid compartment. Fourth, it must be distributed properly in the compartment. Suppose if I want to measure the compartment extracellular fluid, so the dye must be distributed evenly inside that. It should not change the color as well as volume of the body fluid. If we are injecting the dye and it causes change in the volume, that dye should not be used. And after completion of the work, it must be excreted easily. So these are the 6 criteria for the dye: non-toxic, mixing, measure, distribution, color, volume and excretion. Color volume should not be changed. For the measurement of total body water, we use deuterium oxide, tritium oxide and antipyrine. These 3 dyes are used. So many times the question may be asked that which dyes are used for measurement of total body water. That is MCQ based question. Then extracellular fluid measurement. For measurement of extracellular fluid volume, the dye which we are using, it must be in the extracellular fluid. Okay, so we use sodium is, as I told you, it is extracellular cation, the sodium, chloride, bromide, sulfate, thiosulfate. But here what we use is radioactive substance. So why radioactive? Because we can easily measure. Okay, if it is simple sodium, this sodium mixes with our normal extracellular fluid, so we cannot be able to measure it. So here radioactive sodium. Okay, then other substances, commonly used substance, that is inulin, most commonly used because it remains inside the extracellular fluid. This is polysaccharide and it has a molecular weight of 50 to 100. Okay, mannitol is also used and sucrose is also used. So you can make a small name, MIS, mannitol, inulin and sucrose. This is not insulin, this is inulin. So for total body water measurement, we use deuterium oxide, tritium oxide and antipyrine. For extracellular fluid measurement, radioactive, sodium, chloride, bromide, sulfate, thiosulfate, mannitol, inulin and sucrose are used. Now, for measurement of plasma volume, we use radioiodinated human serum albumin, because albumin is more in the plasma, but this is radioiodinated. Okay, because to measure the plasma volume, markers they are injected and measured which bind strongly with the plasma protein. It will not diffuse, or it will not diffuse outside, not in the interstitial fluid also. And another important substance commonly used, Evans blue dye, T1824. Okay, so this way we can measure the plasma volume. And one indirect method is also there for the measurement of plasma volume, is equal to plasma volume we can measure is equal to 100 minus packed cell volume. If packed cell volume is given, divided by 100 into blood volume. Okay. So if blood volume is given and if packed cell volume is given, this plasma volume can be calculated. Why? Because 100 minus packed cell volume is your RBC volume, and RBC volume can easily be measured by radioactive chromium. Radioactive chromium is used to measure RBC volume. So RBC volume is equal to 100 minus packed cell volume. Okay. Then for intracellular fluid, now we all know that total body water is equal to extracellular fluid, intracellular fluid. Extracellular fluid is plasma, interstitial fluid. Okay. Now we know total body water, we know extracellular fluid. So what we can do is we can subtract extracellular fluid volume from total body water. Again, interstitial fluid, we know plasma volume, we know extracellular fluid, so we can calculate the interstitial fluid. So interstitial fluid is equal to extracellular fluid minus plasma volume. Why? Because extracellular fluid is equal to interstitial fluid plus plasma volume. So if I want to find out this one, I have to move this to this side, minus plasma volume. Okay. So these two things, intracellular fluid and interstitial fluid, they are measured by indirect method. One applied aspect related to extracellular fluid. As absolute extracellular fluid volume is less in the children and infant than adult, means absolute extracellular fluid volume is, if we are talking that extracellular fluid volume itself, but the ratio of extracellular fluid to intracellular fluid normal, what is the ratio? This is 20:40. Now this ratio is larger in the children, means suppose instead of 20/40 this would be 30/40 in children and infant. So what happens that dehydration develops rapidly in children. Okay. Why? Because this is less intracellular fluid, more is extracellular fluid, so this will be removed in case of dehydration. Suppose the child is having diarrhea, vomiting or all, so dehydration is common in children. What is dehydration? That is decrease in the water content of body. It depends on the fluid loss. If the fluid loss is less, that is known as, it can be classified as mild dehydration. If it is more, moderate, and if it is severe, that is severe dehydration. Other classification is, it is isotonic dehydration, means osmolarity is same, hypertonic, osmolarity increases, and hypotonic dehydration. Now, what are the causes of dehydration? Commonest cause, that is diarrhea and vomiting, as well as some endocrine disorders are also, but common one is diarrhea and vomiting. Endocrine disorders like diabetes mellitus, diabetes insipidus, adrenal insufficiency, heat stroke. If diuretic is taken in large amount, that also may produce dehydration. Okay. Signs and symptoms are, in mild and moderate dehydration, the child is having, or the person is having dry mouth first. Person is having thirst sensation, sweating is reduced, less sweating. Skin elasticity, this is one of the important tests. Skin elasticity test is carried out by pediatrician, child specialist, that if we are pinching, this pinch should come back within few seconds. If it is not coming, like suppose if I am giving pinch, my skin is elastic and this will come back to its normal position. So elasticity is reduced here. Urine output is also decreased. Okay? In mild to moderate. If it is severe, then blood volume is reduced and cardiac output is also reduced. And if it is very severe, then it causes damage to vital organs like brain of the child, like kidney and liver. Mental depression also may be produced, coma, and person may go into the shock. Decreased blood flow, that is decreased tissue perfusion. Okay. Next is overhydration. Overhydration, this is opposite, that is also known as water intoxication. Water intoxication means body water is greater than normal. Causes are commonly in the heart failure, there is water intoxication, or ADH secretion is increased. ADH, that is anti-diuretic hormone, so that also increases the body water. Kidney failure also, the person is having increased body water. large amount of drug is given, large amount of water or fluid is given, then also the person is having overhydration. In infants also there is overhydration. Which are the signs and symptoms? The person is having behavioral changes, like the person is drowsy, feeling sleepy, drowsiness, attention is reduced, person may have nausea, vomiting, muscle get weak, weakness in the muscle. And if the person is having severe overhydration, then the person is having delirium, seizures, coma. Okay, so these are all the symptoms of overhydration. So this is all about our topic, body fluids. Thank you.
If you wish to get all topic notes, my book Physiology Notes is available on Flipkart as well as Amazon, and link for both that is given in the description box. And to get the soft copy, my application Vesalius, that is available on Play Store, you can download it and get the subscription. Link for that is also given in the description box. Thank you so much.